Hi, everyone. Nicole here, product designer with Medic. So just here to talk about navigation updates. For the past, I want to say year probably. Michael is smiling because it's maybe more. We've been working on incremental UI updates to the CHT, and we're doing that to more closely align ourselves to material design standards, other apps that are popular so that end users have an easier time to learn how to use the CHT. And we've been doing that in steps for a while. And our last big push is to update the navigation. So as you can see on this slide, the top row of screens has our current navigation, so tabs at the top. And we'll be moving those tabs to the bottom as a navigation bar that's more ergonomic. You can use it with one hand. It's great for people with small hands, as we know a lot of CHPs are ladies. It's how WhatsApp designs their interface, how Facebook designs their interface. So it should be a pretty familiar experience. So I've been talking about navigation updates for a while, and today we have an exciting little preview of what that's going to look like. Caveat is that it's a work in progress. There's no data in the demo I'm going to show. It's missing some titles, but I just wanted to share with the community where we're at. And I'm going to share my screen. So this is our current state of things. We have our tabs, messages, tasks, reports, and what the menu looks like when it's open. And here we got navigation at the bottom with like a little pill highlight. It's very cute. It's aligns to material. It's very exciting. So you can tab through it. The color of the bar changes. It's consistent with the colors we have today. So we're not making a bunch of visual changes at the same time. And there's going to be a page title here. Other actions are going to stay in the top bar. So if you've upgraded incrementally, you can see that filters open from here. The menu side drawer now opens from the left side. And yeah, that's what we've got so far. The app still acts as it is. And that's our progress. So it's awesome to see the team making these strides. It's just an exciting time. And we're hoping this is gonna roll out soon. That's it for me. Any questions?
Yes, hello everyone. Are these coming up in soon to come releases of 4.x?
I can take that one. Yeah. So we're, as Nicole mentioned, we're currently working on this, and as you saw, we're making really good progress on it. Our goal is to have this completed by the end of the quarter, so next couple weeks, and I think you'll see it in a release probably, early October or something like that. But yeah, it's coming soon. This will be feature flagged, or you can opt out of it temporarily. So both versions of the nav will be available for a period of time, just like we did with some of the other UI upgrades. So you'll be able to still have some users view the tabs at the top for a period of time, and some users you can have see the new nav. And then probably alongside a 5.0 or something like that, I'm not sure, we will totally remove the old version of the nav. So with the tabs on the top, at some point it will go totally away. But our goal is to have this released in the next month, basically. So ideally beginning of October.
Thank you.
Yep. My name is Michael Cohn. I'm a product manager at Medic. So we recently analyzed some telemetry data from the national deployment in Kenya, and we wanted to share some of the insights into what we've learned so far from this data. The data that we analyzed came from July and August of this year. It included about 12 million telemetry data points, and it reflects usage from about 13,000 users. Just a quick reminder that telemetry data is automatically generated by the CHT, so there's nothing that you need to turn on or off to start collecting it. It's already there. And you can use it to help understand how users are interacting with your CHT app, whether or not they are encountering any problems, and to pinpoint some focus areas for further performance analysis. We can also use it to understand uptake of certain features and to identify opportunities for new research and development. Cool. So one of the first things that I saw looking at this data, it was really interesting was that CHPs were loading the messages tab a lot, more than any other tab actually, but they were almost never tapping into an actual message. So you can see that the messages page itself was loaded around 650,000 times, whereas they actually only clicked into an actual message about 1,500 times. So the data doesn't really tell me why this is happening, but it's probably because users were trained to use it but aren't using it, or that this tab was actually never meant to be used and should probably just be removed, which is a simple configuration change. So again, this doesn't really tell us specifically why they aren't doing this, but it tells us that it helps inform what areas we should dig into more from a research perspective. Cool. The next thing that really jumped out was just how consistently slow the forms used in commodity workflows are. 62% of commodity count task forms took more than 12 seconds to load. 58% of commodity count action forms took longer than 12 seconds to load, and 100% of commodity received task forms took more than 12 seconds to load. Again, this isn't going to tell us why those forms for this use case are slow, but the fact that most of the forms in this specific, in like the commodity workflow are so slow compared to other forms suggests that there's probably something common in these commodity forms that is probably causing this slowness. So again, doesn't tell us the answers, tells us what questions we should be asking and where we should be doing some deeper dives. So the most commonly submitted form by far in this data set was the over 5 assessment form. Yet we saw it had a very poor Apdex score, which is means that loading this form takes a long time. The performance wasn't as bad as the commodity forms, but it's probably not a coincidence that the over 5 and under 5 assessment forms both load slowly, while most other forms actually loaded quickly. Again, this will require more technical deep dive, but it's a good starting point on where to prioritize the focus. And this one was actually a pretty big surprise for me as well. Historically, the reports tab has not been a highly used tab, and many projects actually hide it or configure it so that it is only accessible through the hamburger menu. But what we saw was that CHPs are actually going to this page quite frequently and viewing certain reports a lot more often than others. So again, this isn't telling me why they're doing this, but it tells us that we should focus some user research efforts towards understanding specifically why so many users are doing this. And we can use that research to potentially prioritize some features that can help eliminate the need to go, they're basically probably submitting a form and then going directly to the reports tab and looking for that form and reviewing it. So, we can potentially prioritize some features that can eliminate the need for this, or at least make it easier to do it if that's, based on what we learn. So insights like these are actually pretty easy to discover by looking at the telemetry data. And we've already published some SQL queries that aggregate the data in an easy to understand format. So this is a great way to understand how health workers are engaging with the CHT, and it also helps us know what areas we should be focusing on from a development perspective. So we'd love to know how CHWs in your program are experiencing the CHT. So yeah, please run these queries and reach out so we can help you to interpret the data. I'm just gonna drop the link in here in the chat. Yeah, that's all I had.
Thank you, Nicole and Michael, for Care Team's update. I see a question from Andrew. Andrew, would you like to unmute and ask a question?
Hello. Sorry, I didn't expect to actually voice the question, but so what we found, at least in our configuration, is that the message tab is focused automatically as soon as you click on the application. When you're logged in as an admin, I believe that is the case for CHWs as well, speaking on the correction. But would that influence the telemetry data then?
Yeah, totally. And the question that it can help influence also is whether, do you actually use the messages tab? Do your health workers use the messages tab?
No, SMS has not been activated for our version of CST.
Cool. So in that case, you should probably, there's a configuration that allows you to not show the messages tab at all. So that way, right now they're loading the messages tab, but there's no purpose to ever go there. So you might as well just disable that tab so it's never shown.
That's fair. Thank you. Is there a configuration to set which tab needs to be focused by default?
Not currently, but based on what we're seeing from this data, that is something that we are going to prioritize for Q4. Cool.
Great.
Were there any other questions in there?
I have one, we talked about UI UX optimization as well, right? So Michael, when would you say it is essential that we work on optimizing a form load or form save or anything based upon apdex, like something that helps us to prioritize?
Neeraj, can you go to I think it was two slides previous? There we go. So I think this is a good example for that. So we didn't talk about specifically how these apdex performance scores are calculated or what the different numbers mean, but that query that we shared, if you run that, you will immediately see, it does the calculation for you, and you'll immediately see which forms are performing poorly from an apdex perspective. This is basically looking at the render time for forms. So basically from the point that they select it from the slide up drawer there, you can see the little finger tap there. From the time that they tap on that to the time it actually renders the form, that's what this measurement is here. And I would basically prioritize based on the volume, like which forms are they using most frequently and which ones have poor scores, poor, bad, or so forth. So yeah, that's how I would kind of recommend prioritizing that, is like if there's a form that is performing poorly but almost never is part of their workflow, then I would prioritize that lower than one that gets used very frequently. I mean, you can see here this the over 5 assessment has, it is like I think it's like 40 or 50% of total forms that they submit are these over 5 assessments. So I would encourage investigation into that form because it performs poorly.
Thanks, Michael.
Great.
Yeah, thank you. Yeah, hi everyone. My name is Marina. I'm app developer manager in West Africa. But basically, my comment, it's not a question, but it's really a comment. In general, assessment forms have a lot of images. And I am wondering if this somehow impacts the slowness on how the form is loading.
It might, yeah. I don't actually know the answer to that. There might be some other app develop or other teammates that know the answer to that, or have seen some actual data behind that. But that's a possibility. So, yeah, there might be some opportunities to have smaller image sizes or something like that. But yeah, there can be some more investigation into that, or maybe some others might already know the answer to that.
Can't speak to the, hi everyone, I'm Ashley. I'm a product owner based in the US at Medicare. I can't speak to how images load, except that for sure we know that calculations will slow down a form being processed, especially as it transitions to the initial page load and then to subsequent pages. So the reducing the number of calculations and reducing the number of objects that the form is dependent on as far as parent objects and processing that happens within that. I haven't seen any data around images. My gut says that I would be surprised if it would slow it down. For example, I don't think the training cards on this same deployment had any issues with the large number of images they showed on that. But I can't say for sure. I kind of want to do a little case study on this form, Michael, on the over 5 assessment to see what the result is to reduce the load time. Maybe there's an interesting follow-up we can do.
So in future, Michael, do we expect to see more of like diving deeper into these findings on what caused the performance issue of these forms?
I would say, not just the performance of these forms, because a lot of that is really dependent on the projects, and I would encourage some deeper dives across, all different implementations of this. And I'm just looking at one data set here. I would encourage other implementations to run these queries, look at the data. Again, we would be very happy to kind of work with you to help interpret some of this data and figure out some focus areas.
Hi again, I'm Ashley Jones, the product owner based out of the US, and the first part of this presentation is going to be from Michael.
Awesome, thanks. So yeah, we last couple, I think it was the last roundup we presented, we did some demos for these as well. So there's some recordings out there, but basically in 4.10, we included a number of improvements to the aggregate targets feature, which is generally used by supervisors. Again, this only affects the aggregate targets. It does not affect the personal targets. But one of the first things that that you'll notice is different is that there's now a filter for the reporting period, so you can view aggregate targets for the previous month. So by default, at the beginning of the month, when the calendar month flips over, it's going to show you only data for the current month. But with this feature, you are now able to see data from the last month in the aggregate targets. The other thing that we added here is I forget exactly which release it was, but we enabled multi-facility supervisors, so supervisors who oversee multiple areas in the hierarchy. At that time, the aggregate targets did not support those supervisors, but now it does. So if you have a supervisor that has access to multiple hierarchy, like multiple CHUs, for example, these supervisors will now be able to use aggregate targets and be able to use the reporting period filter. These are not, they're not things that you need to turn on or off. They're automatic for users who have access to aggregate targets. So again, let me copy in the documentation for that, because it's probably a little bit of a narrow set of users, but it was some important features to re-enable this for those supervisors and allow them to be able to see the previous month's data. So that's all I got for that.
Great, thanks, Michael. So the next two features that we're highlighting in 4.10 are the LUN input validation and then some APIs that we've added. The LUN ID input validation is a great mechanism to validate numbers, for example, a unique ID for a location, as they're entered. So this is a little screenshot from Wikipedia where it describes the algorithm to validate this number above. But basically, there's a checksum number that's appended to the end of the number. So after a user has entered in a number, even before submitting it, you can have client-side validation that the number is accurate. I encourage folks to look up the information on how this works. It's both linked to in our docs, and as well the general Wikipedia article is fascinating. I also want to give a shout out that this was another contribution from external contributor outside of Medic, which is really great to see that this is happening. We encourage other folks to try to help out if they can to see features they want to prioritize get merged into main. We've added two APIs to CHT 4.10. These APIs they really encourage accessing objects through the CHT core API. The reason this is important is that we want to remove folks from directly accessing Couch. So should there be any changes with how we present Couch, or in a crazy future where we actually remove Couch or put in a different system to handle requests, you would want to be accessing objects like this. So here there's a place API that allows you to specify a UUID, which I've shortened just to get on the screen here. And you can get the abbreviated version with just IDs in it, or with lineage, which hydrates all those IDs with the complete objects of the parents and whatnot. We continue to flesh out more and more features like this so that the Couch API is not used and that the CHT API is available, especially for integrations, interoperability, external scripts. Anytime you want to manipulate or access data inside the CHT core, we strongly encourage you to use the formal CHT APIs. All right, that's it for 4.10. I didn't see any questions, so if anyone has any of them, please let me know.
Hi, everyone. So my name is Mike, and I work with Brink Innovation. We're a design and innovation company based in Nairobi, Kenya. Next. Okay. So we came up with the idea of bootcamps as an extension of our business model we were testing out as part of an accelerator we were in last year. So we've designed them as learning events aimed at refining the skills of the software developers in our team, who are made up of both working professionals and some studying students. The initial camp took place on 23rd of August and really focused on setting up the local environment, managing CHT app settings, handling application graphics, and building app forms. So the objective is really to maintain and enhance the team's proficiency and keeping them up to date with developments in CHT. We plan to make this a series so that we are able to cover other relevant frameworks and standards as we go along. Right, so the next one is scheduled for tomorrow, and that's essentially what we'll be covering. We're working closely with Medic, so I think Maria Chana will be there, and our partners from Kenya, CHT. Yeah, I think that's it. That's pretty much it.
I have a quick question, Mike. Is it open for all or for everyone or for some?
Okay, so initially we'd set this up for just our team. And this is because our team in the accelerator, we're trying out a sustainable model for managing developer talent. So we've got some team members who are part of our staff, but we also had amongst the guys that went through the accelerator, developers who work remotely as well as students. And so to keep everyone up to date and to remain in touch with them, we designed this type of learning event. So we really structured it around and put in the investment around our team only. We are open to discussing opening this up to include more people, and I guess figuring out ways to finance that as well, or seeing if we can make it something that can be done virtually to allow more people to participate. But for tomorrow, we'd really just worked around the number that we had, and it's kind of short notice to change.
I was just asking if it's exclusive or inclusive, but I think that has been clear. Thank you.
Just the other question too, Mike. What would you say the biggest challenge for the bootcamp is?
Okay, so I think because, can you hear me?
Yes.
So because of our business model, we've got two main ones. And the first is the remote nature of our work and our model. Trying to do them frequent enough and finding enough challenging work to keep our developers skilled, because we understand that this is a perishable skill. And they are involved in other projects that are not necessarily maybe digital health related. So trying to keep them up to date with what's going on. And the second is what was, I think I've lost my train of thought. But I think that was the major one, just really around the remote nature of work and keeping everyone together and skilled and doing it frequently enough. I guess the costs around it, because we're having to finance it ourselves. Yeah, but that's pretty much it.